Hello, everyone. Thank you for joining our monthly health and wellness seminar, one of our many support offerings here at the Margie Petersen Breast Center. If you're watching this on YouTube and would like to watch our future recordings live, we meet every third Thursday at 11:30 Pacific time. You can find our Zoom link in the description box below. I'm Dr. Rebecca Crane-Okada, clinical nurse specialist and program manager here at the Margie Petersen Breast Center, and I will serve as your moderator today. We're accompanied by our host at Alston Novak, who is the administrative assistant for Cancer Support Services and Margie Petersen Breast Center. This month, we're so grateful to have Aimee Sax from Sharsheret. Aimee is the California Support Program Manager and a social worker at Sharsheret, where she provides free, confidential, and personalized support to women and families facing breast cancer, ovarian cancer, and the genetic predispositions to those diseases. She loves to connect with others, whether they're discussing cancer, advocacy, parenting, or shows on Bravo. So welcome, Aimee, and take it away.
Thank you so much for having me. You can go ahead and go through the next couple of slides to start. So yes, I provide support to people facing breast and ovarian cancer. Sharsheret is really here for everyone. We are a Jewish organization and proud to provide a little extra support when people want to talk about how their Judaism or their spirituality, intersects with cancer. But we don't bring up the Jewish piece. So, we have a large percentage of callers that do not identify as Jewish, and we are super happy to support them. And we won't bring up religion unless they do. Never fear if we're here for you. We're here for everybody everywhere. We're headquartered in New Jersey, but we have offices all around the country, and I'm here in LA with all of you. So feel free to send anybody to us or call yourself. Part of why we're a Jewish organization is because there is a hereditary predisposition towards cancer in our community. We, like I said, are here for everybody. And we do things in a lot of different ways. So I'm on our social work team, and I provide support one-on-one or on a conference call to maybe, a couple or mom and daughter or, whoever, is looking for that support. We use the term caregiver very loosely. It's anybody who cares about the person with a diagnosis. So sometimes I'm talking to a friend or a family member from across the country. It doesn't have to be someone, who's in the home emptying drains and things like that. Caregiver is anyone who cares about you or the person with the diagnosis. So we're here for the person, we're here for their family, we're here for their friends, anyone. And then we're also here for community education, community support. So we do trainings like this in person or virtually, just like this, to provide support in whatever way we can, whether it's emotional support or informational support. Go ahead to the next slide. So these are some of our programs listed on this page, just so that you know a little bit about what we do. We do offer really specific peer support. So it's not just stage one, go ahead and talk. It's I'm considering either this type of reconstruction or not to have reconstruction or the other type of reconstruction, and I would like to talk to somebody, who's already done that. Or I want to work during radiation treatment. Can you match me with somebody who worked during radiation? Or my 8-year-old's having a hard time with this. Can you match me with somebody who had a kid around that same age? So, we can really make those very tailored, specific matches. We send care packages, so you'll see some of the care packages here. Our Best Face Forward kit is stocked with makeup and lotions. Everything's paraben and phthalate free. It comes with a eyebrow stencil that helps pencil on those eyebrows when they fall out, and informational support about the cosmetic side effects of treatment. Our Busy Box is for people with children ages 12 and under, because over 12, they're not playing with toys anymore. So we have teen resources to send to them. But for, under 12, we ask, what kind of toys does your kid like? And we send toys based on on each kid's ages and interests, as well as a storybook that explains cancer on a child's level and parenting resources for the parents. Our Thriving Again survivorship kit is, I actually have one right here. I always like to show it off. It's a binder that helps you keep your health records organized, everything all in one place, and then it's completely customized based on your specific needs and interests. So resources on sex, relationships, and intimacy, or exercise after treatment, or how to talk to kids about genetics, things like that, depending on what you are looking for. And then it also comes with a cookbook specifically geared towards people going through treatment and in survivorship. And even an exercise band for when you're ready to start getting active, when you're recuperating after surgery, maybe. And then we do have a caregiver care kit that we can mail. We also have a genetic counselor on staff. Of course, I know St. John's has wonderful genetic counselors, but sometimes you don't want to go through insurance, or you don't want to wait for an appointment, and you just have one question, or maybe you have a family member who isn't ready to talk to a genetic counselor, at a hospital, but you think, they would really benefit with talking to somebody and getting some information about what is genetic testing like, and what are the options if they find out they're positive, or just getting some added context. So she's a really great resource for that. Your insurance will never know. It's completely confidential, completely private, and everything that we do is completely free. And then everything that we have for people with an early stage diagnosis, we also have a slightly different version for people with a later stage or a stage 4 or metastatic diagnosis, because we know that the needs change when somebody's cancer has become chronic, and so we have a different version of our survivorship kit. Same kit, but just different wording and things to make it feel a little bit more tailored for that experience. Go ahead to the next slide. We also have financial assistance programs that cover, non-medical services that are most often not covered by insurance. So some people, if they have really great insurance, they might be able to get scalp cooling covered, but 9 times out of 10, that's not the case. Probably even more than 9 times out of 10. So we have funding to help pay for scalp cooling, to help pay for wigs, and that's a custom-made human hair wig. Eyebrow tattooing, and nipple and areola tattooing and micropigmentation. We know that these are not vanity issues. These are sense of self and self-esteem and things like that, which is why we have these funds. And our income limit is much higher than most financial resources. So a lot of people say, "Oh, I won't qualify," and then when I say, "Well, what how many people are in your household? Let me give you the actual income limit." Then they say, "Oh, wow, I do qualify." So not everybody qualifies, but a lot of people do that would be surprised too. Go ahead to the next slide. We also provide lots of webinars like this one today, that we bring in, a host of different topics, whether it's something, informational or emotional, or, sometimes we'll have a doctor speak, or sometimes we have, a chef come and do a healthy cooking demo. And we also have, Facebook groups that are closed and private, so that you can connect with other people, in your same situation. So we have 4 separate groups: one for early stage breast and ovarian cancer, one for stage 4 metastatic, one for caregivers, and one for people with a genetic predisposition towards cancer. And we record all of our webinars, so they're available on our website. Okay, so now what our topic is for today, now that you know a little bit about Sharsheret and what we provide. I'm sure that none of these things on our slide today are surprising to you. I'm sure, if you've had a cancer diagnosis, you've experienced some, if not all, or most of these. There are so many different stressors that come up for us, right? And sometimes somebody at the hospital can help, right? Sometimes transportation is something that maybe a hospital social worker can help, with, or different, effectiveness of treatment. Is this going to be effective? They can give you statistics. Your doctor can help explain, why they're recommending this versus that. But like things like that loss of control, that's something that, we all need help with, I mean, listen, loss of control ever since COVID happened, right? We all are very familiar with that, but add in cancer, and it gets really complicated. How do you feel, like yourself, when, all of that is going on? That can be really difficult. And then sometimes there are kind of culturally specific issues that pop up. Dating is an issue for anybody, but sometimes when you're in different cultural, groups, that can feel really different. I know sometimes when we're talking to somebody who's like in the Orthodox Jewish community, they might be keeping their diagnosis really private because they're worried about their unmarried family members, and how is this going to cast a negative light on them and their marriage prospects. That can definitely happen sometimes. Fertility, whether it's primary fertility or secondary infertility, can be really difficult. I just spoke with somebody who said, my doctor said, why are you worrying about this? You already have 2 kids. Well, she was imagining having 4 kids, right? And that is still valid, and some of that is a cultural issue, and some of that is just, a personal issue. So, all of these issues are valid and normal and deserve support and help. So that's part of what Sharsheret is here to help with. Go ahead, next slide. So, we were really founded because of this idea of, the isolation that comes with a cancer diagnosis. And certainly we've seen since 2020 how much that can be compounded by COVID, and even though a lot of people are saying COVID's in our rearview mirror, right? And I don't know who saw the update from the CDC yesterday about, they might not even say you need to isolate for 5 days anymore. I know that sent a ripple wave through the cancer community, right? Because I talk to people who are, getting a new diagnosis and they're being told you're going to be really immunocompromised during treatment. And so you really have to be careful. And it's like, well, what does that mean? How do I be careful? I mean, you can hear I'm super careful and you can hear my congestion today, right? It's out there, and people are getting sick, and, that isolation can really create some fear. But we know, that studies are out there that show that connecting with others can really make a difference. And we know that, stress leads to faster disease progression. We know that, when someone's non-medical needs are met, their medical outcomes are better, right? So one of the factors that was studied in that study was just seeking social support, that people had better medical outcomes if they sought social support. So like, let that sink in for a second. Not necessarily that they got the emotional support, but just that they sought it. And what that means is that coming to this program today, right? Connecting with the wonderful support that's offered at, Margie Petersen, or connecting with the support that Sharsheret offers, or all these other organizations that are out there for you, that can actually make your disease progress at a slower rate, right? That can make a difference on your risk of recurrence. That is a really impactful, powerful thing to really take in. So I always like to take a minute there, to let that really sink in for you. Next slide. So, it's wonderful when you can let people in and you can have that connection, right, around these topics, but it can also be a bit of a double-edged sword, right? I once had somebody tell me that her cancer felt like a new purse that everybody had the ability to comment on, right? Once it's out there, once you do start telling people, once you start connecting on that, then people can talk about it when you're not expecting them to talk about it, right? So that can be really, really overwhelming. So always remember that you get to define your community. You decide who knows what they know, but at the same time, always remembering that once the cat is let out of the bag, you can't get that cat back easily in the bag, right? So you have to really understand and be ready for that. And know that there might be moments where, you kind of have to say, you know what, I'm trying to have a cancer-free afternoon. Thank you so much for asking. But I just, right now is just not the time. I don't really want to be talking about that. Go ahead, next slide. So, there's so many different issues that come up, even just the term survivorship, I think can be really tricky for people. Whether that's because they feel like, well, I'm not at the end of my life, so I don't know if I survived this, right? I don't know if it's going to come back. And so sometimes it can just feel like, do I really get to call myself a survivor? Other times, maybe somebody doesn't feel like they can use that term survivor because they feel like, well, I only had DCIS and I didn't have chemo. So I feel like that term really refers to somebody who's gone through chemo or, lost their hair, right? I didn't have to survive that. So do I really get to call myself a survivor? And other people, maybe they have Holocaust survivors in their family and they feel like that's what that term means. I don't get to use that term, right? So that term itself can be really tricky for even more reasons than I just mentioned. But, to remember that the moment your doctor said you have cancer, that's enough, right? That's enough to call yourself a survivor. It's also enough to recognize the fact that that moment is trauma, right? That is traumatizing for a lot of people because the definition of PTSD, right? If we look in the DSM, one of the factors that somebody needs to have to actually be qualified, yes, you have a PTSD diagnosis, and I'm not diagnosing anybody, but one of the factors is that they have to believe that their life was in danger. Not that their life was in danger. They have to believe that their life was in danger. So I don't know who watches Friends here, right? But I always think whenever I'm explaining this, of there's an episode of Friends where they go on a stakeout with a police officer and or a ride along, and they hear a car backfire, but they think it's a gunshot, right? That actually could have caused PTSD. It's a comedy show, so it didn't. But that is a moment that if you believe you're being shot at, right, then that's enough to actually create the symptoms of PTSD. There are other factors in there too, but that's it. So the moment that your doctor says you have cancer, that is enough to believe that your life is in danger because technically it is, right? Even if it's early stage, even if it's, we're going to catch this, or we caught it early and we're going to be able to beat this. It'll be a blip on the radar, of your life. It's still enough to really create that sense of trauma. And so, I think understanding that and working through that is important for everybody. Certainly you can call Sharsheret and I can have many conversations with you on this topic. That alone could be an hour-long training. But, seeking support for processing your trauma, I think, can be really, really important for people because it's going to show up in different ways if you don't try to process it. I always say if you don't, if you sweep everything under the rug, you're going to trip over that rug for the rest of your life, right? So we gotta sweep it. We gotta work on these issues, and understand that it's going to pop up. It's especially going to pop up around your scans, right? So whether they're 6 months or a year or, hopefully one day, even further apart, that special type of anxiety that pops up around scans, we like to call scanxiety. And there are lots of resources that can help you with scanxiety. Again, first, just acknowledging it and working with it is really important. But, meditation can help, exercise can help. There are all these kind of methods of dealing with it. I know we recently had a really great webinar on this topic, and a caller that I've worked with for over 3 years now, someone who called Sharsheret when she was first diagnosed. When she was going through her cancer diagnosis, she took up journaling and meditation and, really had a lot of tools in her tool belt. And now it's been 3 years since her diagnosis and she kind of feels like life has gotten a little bit back to normal. And then when her scans came back up, she called me and she was like, my scans are coming up and I feel like a lot of the things that I've put behind me are right back in the forefront of my mind. And so we talked through it and I said, you have a lot of tools in your tool belt. And she was like, you're right. Okay. And I said, and I'm also one of the tools in your tool belt, right? So the conversation we had, I think, was really, really helpful. But also she realized I I haven't been journaling every day. Let me try to take that up again. I haven't been meditating every day. Let me try to take that back up again. And she found it was much better. She also sought a lot of social support. So she knew that that day before her scans was going to be a nightmare if she was just alone with her thoughts all day. So she made plans with friends, and she, did all these different things to really make sure that she was distracted, right? Sometimes it's just about getting by, right? And so sometimes it's binging a Netflix show or, doing what you need to do to just get by. Just know that scanxiety is real enough to have a name. So you're not alone with that. The other, big issue that can come up is that fear of recurrence. I'm a social worker. I love metaphors. I know I've already used like 5 metaphors so far. I'm going to give you one more. So the fear of recurrence, I like to think of as a scary monster. That sometimes when you're really feeling that fear is screaming in your face, right? And it's just saying, the cancer is going to come back. You're going to die. You're not going to make it to your kid's graduation or, whatever milestone you have in your mind, right? And it's just terrifying you. We would love to throw that monster out the window, right? But it's a monster, so it will climb back in that window, or maybe it will fly back in that window. It's a monster. It can do whatever it wants, right? So the goal is not to just get rid of it, because also remember, your fear of recurrence is why you go to your scans, right? It's why if the cancer does return, it'll be caught at an earlier stage, right? It's why if you're going to make lifestyle changes, it's why you do those, right? It's why you do all of these things to help keep yourself healthy. It's why you did treatment and surgery in the first place, right? Is to reduce that risk of recurrence. So a little bit of fear is actually a good thing. It can sound like an oxymoron to think of like healthy anxiety, but we all need a little bit of anxiety or we'll just lay in bed all day. We won't pay our bills, right? So you have to have a little bit of that, but you have to find a way to live with it, to make it that healthy level, right? There are going to be moments where it feels really unhealthy and you fall down that rabbit hole of anxiety. And sometimes you have to feel those feelings. But what really can help is next time that monster is screaming in your face, you say, okay, monster, I hear you. And you address the fears, right? And you say, I get why you're scared about that, or I get why you're telling me that's going to happen, but that's why I did chemo, or that's why I did radiation, or that's why I did surgery. That's why I did X, Y, and Z. And to remember that you did these things and that being fearful is in this moment is not actually going to change your risk of recurrence. So you acknowledge the fear and then you remind yourself, okay, I get why I'm feeling this way. This is what I've already done to reduce my risk. And beyond that, worrying isn't going to help. Easier said than done, I know. But then you can hopefully sit the monster down, right? Give it a coloring page or ask it to knit you a scarf, right? And that monster is there. It's in the corner. I can see it, right? And that's okay because it's sitting. It's not screaming in your face anymore. And then slowly over time, whether it's that day or years from now, right, you're going to be able to slowly turn. So, okay, the monster's in my peripheral vision. I can see it. It's there. But it's sitting quietly, and I can address it. Okay, monster, I hear you, but I'm doing this now. And slowly you can even turn your back on the monster. I'm so sorry. I'm going to mute my computer. So, you can slowly over time work with that monster, and that cycle of having it yell at you, addressing it, moving on can go quicker, right? So you want to get in the habit of that. And one thing that really helps you get in the habit of that is meditation. And I know a lot of people say meditation is not for me. I'm bad at meditating. My brain, I just can't quiet it. They have a misunderstanding of what meditation is. So meditation is not trying to clear your mind of all thought. Meditation is an exercise that helps you choose where to put your focus. And when you do that little reframe and you understand it in that new light, sometimes it becomes a lot easier. So what I mean by that is if you want 6-pack abs, right, you have to do ab exercises every day, right? Or at least 3 to 5 times a week, right? So the goal is try to meditate every day. But if all you do is 3 or 5 times a week, that's okay too, right? Anything is better than nothing. And to remember that you have lots of tools, right? There are so many meditation apps out there. If you email me, I'll send you my favorite ones, right? So right now I'm just going to walk us through a quick meditation exercise. It's what I call, or what is called a grounding exercise. So right now, choose a spot on the wall opposite you and just describe that spot in your mind. What color is it? Is it in light? Is it in shadow? Is it bumpy? Is it smooth? Is it curved? Is it straight? Just noticing that spot on the wall. And now switch your gaze from that spot to the air in the center of the room between you and that spot. So just a soft gaze on the air in the center of the room, and that spot that you had been focusing on is a little fuzzy now. And now refocus to that spot on the wall. So that was it. You all just meditated. And I bet that your mind wandered during that 35 seconds that we just did that, right? And maybe it was, what is Aimee talking about? How is looking at the wall going to help me with cancer? She's crazy. Or maybe it was, oh, I forgot to put rice on the grocery list. Or maybe it was something else, right? But then you heard my voice give you another prompt and you refocus to the task at hand. So that is the moment that's like a crunch when you're doing ab exercises, right? That's the moment when you kindly redirect yourself to the task at hand. That is what meditation is all about. You actually want your mind to wander because you have to get in the habit of that redirection, right? And when you can get in that habit of just kindly saying, okay, Aimee, I get why you're thinking that, but right now let's focus on this body scan, or right now let's focus on this exercise, or right now let's focus on whatever the meditation teacher is saying on my app on my phone, right? That's the moment that's going to help you in the moments you're not meditating, in the moments when you're talking to that monster, right? In the moments when you're freaking out about these really big issues that you're going through. Sometimes you have to just freak out. Other times you have the ability to say, okay, I get why you're worried about that, but instead let's focus on the task at hand, right? And then you can switch gears to something else, whether it's going for a walk or listening to the story your kid is telling you, or getting back to work, or, for me, cooking is a very mindful exercise, because if I don't focus on what I'm cooking, I'm going to burn the food, I'm going to burn the house down, I'm going to chop my fingers off, right? So you have to focus, right? So choosing those meditative experiences in your life where you can just keep redirecting yourself to the task at hand, those things can really help you in those moments. Go ahead, next slide. So, thinking about, what issues have you faced in your past, right? Whether it's your cancer experience or other challenges that you faced in your life. And thinking about, how did you get through that, right? Maybe it's a friend that was really there for you that you can call now that you're having a hard time, or maybe it was, kind of what I was mentioning earlier of, oh, meditation and exercise and, all of those things really helped me. Or maybe it's, all these different things, right, in our lives, all these strengths that we have inside us, and, how can you kind of utilize those strengths that you have, whether they're in your community, resources out there that you haven't connected with, like Sharsheret, or other things, out there that, out there or in you that can help you, get through these moments of stress and anxiety and, these emotional issues that really do come up for all of us. And definitely, if any of this makes you want to connect with Sharsheret to get our free resources, or connect with me to talk about more metaphors and other resources that we have and also that other organizations have, definitely please get in touch. I'm here for all of you. And I mentioned that we're here for everybody regardless of background. Also, sometimes people call with a different type of cancer. So, breast and ovarian cancer and the genetic predispositions towards them are our area of expertise. But I'm not going to turn anybody away if they have another issue that they want to discuss. Anybody have any questions?
Thank you, Aimee. That was great. Does anyone have any questions that they'd like to ask? I think your metaphors were great. I will remember those. They're illustrative of these experiences. And I will add too, that if anyone wants to reach out to Alston or myself, we can provide resources as well, and on mindfulness and meditation. Any other questions before we stop the recording? There's one in the chat here. Okay. Someone who had to leave said this was awesome.
Thank
you.
them. I do have one more meditation. I mean, one more metaphor, if anybody wants one more, that I meant to say about the fear of recurrence. You know, during treatment, it can feel like, well, I have so much on my to-do list. I have all these doctor's appointments. I have, you know, these medications I'm taking or these treatments I'm having, you know, and it can feel really good. And so one person once said to me, you know, it feels like I put my emotions in the freezer. And now that I'm done with treatment, now that I'm in this like survivorship journey, right? Now I feel like my emotions are coming out to thaw. And so, sorry, I guess two metaphors. That was her metaphor. Now my metaphor is that when you're in treatment mode, that's a very normal experience to kind of not be super connected to the emotions of it all, and to feel like you're on a battleship, right? You have all these people around you. You know, when you're in the hospital, like I've been to the Margie Petersen Center and, you know, walked around, and it's like, I don't even know how people remember where to go, right? Like there's so many people there, and they're all working to help you, right? And help you get through this. And then when you're done with treatment, right, you're not there all the time, and you're not surrounded by these people, and you have a lot less on your to-do list. And, you know, those, you know, weeks between appointments can be longer and longer and longer. And so it feels like you go from a battleship with thousands of people, you know, around you all the time, working to keep you healthy, to now you're on a raft out to sea alone, right? And so just to remember that, you know, all of these resources on this slide, you know, are all here for you. Sharsheret's here for you, and there's so many more organizations and resources out there, you know, so it feels like you're alone on that raft, but we're all here, you know, and ready to you know, hitch up our raft to yours. So, you know, just remember that you're never alone. Now I'm done. Thank you.
I have just one follow-up question. So, I'm a newly diagnosed patient, but I'm waiting for my genetic testing, and I recently learned like there are other BRCA people in my family that I had no idea about. So I'm kind of waiting for that
Yeah.
result to come in before I know for sure if I'm going to have an easier time of this.
Mm-hmm.
So I wanted to talk to, I don't know, I guess, so the plan would be like, I would email you and then we'd talk. Is that how?
Absolutely. Yeah. So the way things work at Sharsheret is, you know, you reach out, or, you know, you get connected somehow. And I start every phone call pretty much the same of, you know, maybe you reached out for something specific, but if you tell me your story as you talk, I'll get different ideas of ways we can help, right? So certainly, you know, what you're describing is, I can imagine, you know, the types of anxiety and the types of thoughts swirling around you right now, right? There's a lot, right? So I always say to people, you know, in your shoes, before the treatment plan is clear, before the genetic testing is back, before the pathology is back, you know, there's so many points. I was talking about this earlier about that loss of sense of control. There are so many points, especially at the beginning, where everything's up in the air. That truly is the hardest part of the cancer experience, I think, for most people, right? When things are up in the air, it's really, really difficult. So that is back to what I said about, like, sometimes the name of the game is just to get by, right? That's when you need to pick a show on Netflix to binge, right? That's when you just need to fill up your time with, you know, coffee dates or lunch dates or phone calls or, you know, whatever it is. And certainly that is when you call Sharsheret. You know, that is what we are here for. And I'm sure, you know, Rebecca and Alston have ideas of ways they can help you too. You know, we are all here to help you get through that difficult part where things are still up in the air. You know, once you know what your plan is going to be, once you actually know how those parts of your plan feel, right, to experience, it gets easier, right? When we're waiting for surgery, when we're waiting for treatment, like those are such difficult times. I will say, I think people get very worked up about their genetic testing coming back. And so I always like to say that whether it's positive or negative, it's information that's going to help your doctors decide what the best course of treatment is, right? Whether it's positive or negative does not doom you to one thing or the other, right? It just gives them clues as to how to help you best. I understand that it's so much more complex than that. And it does create new questions and new options for you, right? So I'm not trying to belittle your anxiety at all. I think anybody would be feeling it however you're feeling. But just to say that, I think a lot of people inflate the importance of that a little bit, because it is important, absolutely. And, but don't feel like the answer is going to, change the experience so much. It is going to change it, or it could change it, but that you're going to be okay either way, hopefully, and it's just going to give your doctors more data that's going to help them make the best decisions for you.
Thank you.
Thank you for the question. It was great, and I appreciate so much having you here today, Aimee. We're going to close the recording now, but if you want to stay in touch, these are some of the resources. You can subscribe. We are also on Instagram at MPBC Breasties, and you can follow us on Facebook or LinkedIn for the St. John's Cancer Institute. So thank you again, Aimee, for being here today. I'm Rebecca Crane-Okada, and Alston Novak has been assisting. And we thank you for being with us today.